Hello, our topic today is facelift. We took a break for a long time. We didn't talk much about facelift. Now is the time. We entered winter. The holidays are over. I think it is the best time for facelift surgery. Briefly, I would like to give technical information about facelift. There are various techniques used in facelift all over the world. One is the classical technique. One of them is the deep plane, which we call deep plane techniques performed on the bone. One of them is Heisman's facelift technique, which I use and like more. The advantage of this technique over other techniques is, first of all, that there is no excessive amount of edema. Secondly, it is a procedure that collects not only the lower face but also the middle face. And the results are quite natural. Usually this technique is combined with fat injection. However, in order to shorten the operation time, we can occasionally perform a fat injection first and then only a facelift in a later period. How do we perform the procedure? We make an incision in front of the ear, in front of the cartilage, just inside it, and return behind the ear. And the incision continues from the border of the scalp. Therefore, your scars in that area are almost invisible. In the temple area, if you need to lift your eyebrow, we look at the excess skin in that area. If there is a lot of excess skin here, then we do it through the hairline. If there is less, then we do it through the hair. If there is a lot of excess skin and when we do it through the hair, this place can slide back quite far. The hairline can slide quite far back and disturb you. These are, of course, technical things. The most important thing that our patients should pay attention to before surgery is to stop using medications that increase bleeding at least 10 to 15 days before surgery, and if they smoke, to stop smoking at least 6 weeks before surgery, if possible 2 months before surgery. Because the filaments that form when we lift the skin in facelift, that skin is nourished by a very thin and tiny network layer. But when you smoke, your veins are flattened, the blood flow to that area decreases. Therefore, there may be areas in the skin that are not nourished after surgery, or we may encounter various healing problems. Therefore, smoking is very important, and blood thinners are very important. In facelift surgery, of course, we collect the middle face, collect the lower cheek, and in the meantime, we shape the neck area with the incision we make behind the ear. This is not only about shaping the skin. The recovery of the tissues under the skin, the sagging tissues, is also a procedure that must be performed in facelift surgery. Because sometimes I receive emails like this, "Hokam, can't you remove the skin from the front of my ear with a tiny incision and sew it?" There are those who do this, but in my opinion, it is a procedure that should definitely not be done, because you will return to your old state very quickly. Apart from that, what do we encounter after the surgery? First of all, there are thin, tiny tubes coming out of your face in order to take out the blood, fluid, etc. that may accumulate inside. Those tubes are collected in a reservoir and take the blood and fluid outward. There is at least one on each side of your face. Apart from that, you need to pay attention to your lying position. You can sleep with a small towel or a roll under your head. We do not want you to sit by bending your neck down too much after the surgery. We want your neck to stay upright as much as possible and the healing to be completed properly. There may be adhesions while healing if you constantly tilt your head, sit like this, read books like this, and eat like this all the time. It may be necessary to stretch and flex this area. These need to be paid attention to. 3 weeks after the surgery, yes, your edema will decrease a little bit, or after a month, but I always tell patients that it will not look very good. You need to wait a minimum of 3 months to look good, but your best appearance will be after 6 months. Because this surgery is a surgery that sits slowly, I can say that you will look quite bad, especially in the first month, because there will be an unnatural swelling, an upward retraction, etc. If injections have also been made, these will of course be more. But this situation should not worry you. This is the case all over the world. Patients do not look very good before 3 months. Even in many non-surgical procedures, we sometimes tell patients to wait 6 months, which is one of our major surgeries, such as facelift. If you want a procedure that will manage your face for a long time, if you have no time concerns, if you have no concerns about the healing process, if you are over a certain age, facelift surgery will of course make your job easier. You can call our clinic for detailed information. You can reach us via our YouTube channel. You can contact us via our WhatsApp channel. See you soon, love.